Hello, everybody. I'm here today with Brandyn Roark Caires. She's a licensed clinical mental health therapist in the US, and she's worked in the mental health field for over 22 years. She specializes in supporting children, adolescents, parents, and families in her clinical practice. And over 85% of her practice is focused on supporting children and adolescents who live in two homes and the co-parents navigating parenting from two home structures. Just such important work. She's a specialist in collaborative divorce and a mediator and co-founder of Parent Team. Welcome, Brandyn. It's absolutely lovely to have you here.
Thank you so much, Heather. Thank you for having me. I'm really delighted and grateful to share this information with you and everyone.
Thank you. So today we're going to talk about trauma and divorce, the effects on children and each other. So shall we begin? What is trauma? What is trauma in divorce?
I think, yeah, it's a great question, and we use the word trauma a lot. Fortunately, we use the word and the term trauma a lot more now than we did even 5 years ago, a decade ago. So there's more research, there's more understanding, there's a lot more literature out there and great books that have been written. And the way that I really appreciate trauma being defined, Dr. Nadine Burke Harris, who was from the US, she's a pediatrician, and the way she described it is when our stress response system gets so overwhelmed that we can't cope anymore, right? So our stress response system gets activated, and we're activated, and we don't have that ability. Our body doesn't have that ability, and our mind doesn't have that ability to be able to cope and to process and to self-regulate through a possible traumatic event. Now, that can be anything from, a one acute event like a car accident, or that can be chronic. So over time, continued traumatic events, abuse, neglect, individuals who experience racism, individuals who experience war. So there are just a lot of different types of events. And there's also how we manage that, in our own personal world and in our life. And from 1995 to 1997, Kaiser Permanente out of San Diego and the Center for Disease Control and Prevention did a very large scale population study. It was about 17,000, I think actually even more, patients. And they asked them a series of different questions about what are some of these possible traumatic events in children's lives, right? So they kind of looked at, I think it was 17 years of age and under. And there were sort of three categories, which was abuse, different types of abuse, different experiences of neglect. And then also this category over here, which is like household dysfunction. Okay, so we have different challenges with addiction. And what's interesting to me, and what I've always been interested in my work within mediation and divorce and working with kids with two homes, is that divorce is an ACE, an adverse childhood experience. It is on that ACEs questionnaire, it is considered a possible traumatic event for children. And I think it's just really important that we know that it can be experienced that way for young children, teenagers, and even the adult children of divorce that I work with share their experiences with me, right? They're 35, they're 42, and their parents are going through a divorce, and they're like, I don't want to hear it. I'm still your kid, even though I'm 40, I'm still your kid. So it's important that we know some of the factors of the why. What is the data showing us about why divorce is on there? what are some of those factors? And two of the bigger ones, the most impactful for children, and I see this in my work every day when I work with kids in my office and when I work with families and I work with co-parents, which is ongoing chronic parental conflict.
Yeah.
And I don't mean the one or two blow up fights that parents have in front of their children when they decide, well, I'm getting a divorce, right? We're not talking about those whoopses that we do as parents. I've done that as a parent, just in terms of like, oh shoot, I could have done that better. We're talking about that sort of chronic, ongoing, sometimes I almost define it as an undercurrent. Sort of there's this undercurrent, even if it's not explicit in front of children. Children are little vessels of emotions, right? They hold everything and they
They
contain.
feel it. Yeah, they feel that bitter resentment and the struggle for power.
Absolutely. Yeah, that's a beautiful way to put it. They feel that. They feel when they're put in the middle. They feel when they're asked to be a messenger. They're, well, what did you do at your mom's house last weekend? Did you meet so and so? What did you do? Did you brush your teeth? Did you, right? And so they're asked questions constantly. Did you meet dad's new girlfriend? Did you meet dad? So those types, even some of that can be, if it's ongoing and there's not an intervention to help support that family and to help support those children and those parents, this can be a really strong current in a child's life.
Yeah.
So it's the
steady
ongoing,
panic.
stress response system, right? So I'm activated. And then over time, what I notice with a lot of children that I work with is it becomes so normalized. So I have like a little heart rate monitor that I use with kiddos. It goes on their finger. And in my office, a couple things, like maybe a parent who's not supposed to be there, it's not their parenting time, will just show up at my office, right? And not listen to my boundaries. And a child will walk out and see that parent, and their stress response system early on would have been really activated. Like, oh no, my parents are big fighters. They don't get along. What's my other parent doing here? And I've helped kids navigate that. Like I work in a world of a lot of conflict. But over time, what I noticed with some of my kids, they don't even have a stress response. They don't have a response anymore because it's become like so normal. And, in helping them, because then we look at the impact in their life as adults, right? How does that affect their ability not only to self-regulate in their own lives, but to set healthy boundaries, to know, where do they begin and end and their parent begins and ends. So you have a lot of enmeshment, a lot of kids trying to take care of their parents emotionally. So there's that piece, the ongoing parental conflict. The other part of that adverse child experience or traumatic experience for children is the dramatic change or loss of a relationship with a parent. So if I'm a child and I went from seeing my parent every day, right? I saw them every day. Maybe they came home, maybe they were late. Maybe they worked a lot and they didn't come home till 7 p.m., but I always saw them and I had a relationship with them. And then all of a sudden, my new parenting time with that parent, maybe I see them 2 weekends a month. Maybe I see them just in the summer. And I have kids who have experienced that. So there's also that dramatic change. Or sometimes, and I know it's different in every county in the United States. I know it's different there, and in the UK and in all of our different countries where we have different divorce proceedings. But in some countries where I've consulted with different lawyers or mental health practitioners, children are more automatically given to one parent or the other with parenting time and with custody. So we really got to start talking about the impact of attachment and that relationship with those parents. And what's the story those children are walking away with in their life?
Yeah, absolutely. Because it seems to me we just forget about the emotional bit. We look at the practical abuse, we look at the practical neglect, we look at the sort of practical indifference or the literal practical effects of living in two homes, or
Mhm.
witnessing continual bickering and bitterness and all of that. We don't look at the emotional. And
Mhm.
and that's what you're talking about. The children get into panic, and it's like we get into panic. But if we are children of divorce, we get into panic. And you
Mhm.
talk about self-regulation, and it's how do you stay calm in that situation? How do you not dissociate, which is sort of what you're saying? They become sort of numb and it's normal. How do you
Right.
stay as a parent, focused on your child's attention at the same time as managing your own feelings? This is really important developmental work that we need to do in ourselves as we divorce so that our children can too. I know this is slightly at a tangent to where we were planning to go, but it just come up to me as we're speaking.
Yeah, I mean, that's part of so Jen, my business partner, when we started Parent Team, and it's resources for parents and also for professionals. Yeah, I'm so glad you brought that up because, when Jen and I started Parent Team, which is our company to help support two home families and the professionals that help support two home families, like lawyers and mental health practitioners and financial practitioners, we really started our work in our workbook and our course around helping the parent first and helping them first as an individual, as a human being. And unless we're able to self-regulate, and a little personal disclosure, I've been through a divorce. I remember what that felt like when you're in a divorce fog. Like, you have to make all these important decisions about your children and about your finances. And if you don't have children, you're still making massive decisions about your future. And I always called it the fog because our prefrontal cortex, the best part of our brain, the CEO, the boss of our brain, shuts down. And when we're in stress and we're not prioritizing, organizing, making wise decisions, and that's sometimes why we show up in ways that we may never have thought we would have shown up in these really stressful times in our lives. So
Yeah.
helping parents first, because parents are disassociating, they're checking out, they're in the fog. So helping them first calm their regulatory systems and just find some of that space so then they can co-regulate with their children, help their children to regulate is really important.
Mm. So by regulate, we mean calm down so that your blood is in the frontal cortex, not in the reptile fight and flight. And you can just think and decide from the most rational, kind, compassionate part of you, rather than
Yeah.
part of you that is regressed, might be behaving as a 2-year-old if you've got emotional wounds that go back that far, or a 10-year-old, or in some sort of playground competitive way. Yeah.
Yeah, I think one of the best ways, right, when we watch a young toddler or even I have a 6-year-old. So when she's dysregulated, right, maybe she's yelling, she's crying, her body, I always think, okay, how do I help her regulate neck down first? Regulate her body, come back into her body. And then we'll talk about like the behaviors, the stuff, all of the things. Well, it's very similar in us as adults. We just have learned more social skills, but we're really dysregulated inside sometimes. And I love Marsha Linehan's work in dialectical behavioral therapy. She talks about the wise mind. So we have our emotional mind, we have our rational, reasonable, right? Like sort of that logical mind. And when we can bring the two together and honor our emotions that are in the room, but also have our brain online, we can find our wise mind. And I really love to help coach a lot of my parents and a lot of my collaborative divorce clients that we want you to make decisions and be able to tend to your children when you're in your wise mind. So let's help you with some tools and strategies to find that wise mind.
Mm. So I guess this is the part as well in this section of our podcast where we talk about conscious uncoupling, because that's how
Mm.
you and I met. You
Yes,
want to
I'm so grateful.
do you want to say a bit about it? You know, what conscious uncoupling does and how it helps parents?
Yeah, I mean, I read the Conscious Uncoupling book from Catherine Woodward Thomas many years ago. It, I don't think she had written it yet when I went through a divorce, but I read it a few years later. And I was like, oh, this looks great. And I do collaborative divorce work and mediation. And I had always asked a lot of my clients to read her book. And then I discovered there's this whole coaching model, this beautiful, there are coaches all over the world who are there to help, with 5 or 6 sessions, maybe sometimes a little bit more of just some very specific support and help in and through a breakup. And I think that's so important because sometimes what I've found is mental health therapists that I've worked with don't understand that very unique process more than a grief process, right? It's very deep
Absolutely.
and very, yes. And so the conscious uncoupling work that I have seen my clients do, whether they're a co-parent I work with or a collaborative divorce or mediation client, it's pretty astounding the growth and the journey of accountability and healing themselves. And I think sometimes there's a misconception that conscious uncoupling is done with as a couple.
Mm,
It can be, but that's definitely not the norm. In my experience, the norm is individuals just meet with their own coach. And it's beautiful. It's a beautiful 5-step process to really bring individuals from really a place of, sometimes we step in. I remember this in my divorce of like, this is happening to me. I have no control over this. I have no power in this and feeling in a victimized place. And it really helps people in that transformational journey to come into this space of, hold on, here's what I'm in control of. Here's where my power is. And how do I move forward in my life? One, in new relationships, but also the beautiful part is when I see both parents being willing to do conscious uncoupling work in their own separate time. And then they come to the table with a different co parenting relationship. And
it's
that's beautiful.
absolutely wonderful. That's wonderful. Yeah, and what I love about it, it sort of pertains to what you've been saying about regulating. That the first piece we do is help the parent, the divorcing partner, to calm down and to teach them ways of having inner conversations themselves with all the different parts of them from that wise mind, from that compassionate mind. You know, I see people with their little child self on their lap, that's maybe
Yeah.
been through divorce as a child, seen their parents divorce or had distress that gets triggered by divorce. And they want to identify with that part and live from that. So the wise mind takes that on their lap and says, no, it's okay, kiddo, I've got you now. I've got you now, and I'm making the decisions. You can just relax. And then the wise mind also looks at the internalized parenting messages or other big influences from authority figures from being a child and stares them down too. It doesn't mean I'm not good enough. It doesn't mean I don't belong. It doesn't mean I'm not worthy of love. And that's the context for me of conscious uncoupling, really looking at those patterns and stopping
Mhm.
them replicating. So this part in the middle is really able to hold steady and reflect. Now, what did I do that got me to this point? How was I relating to me? How was I relating to my partner, husband, wife? What was I doing? What was I thinking? What was I assuming? How did I
Mhm.
give my power away? How did I stop being me? Because quite often, that's there. People compromise and compromise and compromise till there's nobody left to love because there's no firm
Right.
identity, just an absence. And that can
Right.
happen with both sides at the same time, which is very painful to
Yes.
see.
Yes. And I've how we met, right? Was you were interviewing me to be a conscious uncoupling coach and go through the training, which I'm so grateful that I stumbled upon that from a colleague. And I love the point in working with clients where it's almost like a shock. They're like, oh my gosh, this is completely from when I was 3 years old. This is totally when such and such happened when I was 5. And how we, wash and recycle, wash and repeat throughout our lives. And we have this really pivotal moment and this chance to transform and show up differently for ourselves, and also for, if they're a parent, for their kids, for their co-parent, in work. I mean, it's really just, it's such beautiful work.
It is. So they can be there for themselves from that wise place, but they can be there for their children and give the children maybe what they didn't get as a child. The developmental pieces are so important, that the actual growing up and the maturing, and the self-care that is fundamental to that. I just love.
Yeah, so important.
Mm. So let's talk a little bit about children's experiences of divorce.
Mm.
What do you see?
Yeah, I mean, I think I have kiddos who come to me in all different stages, right? So maybe parents are contemplating divorce and they come to me and ask, we want to get them some support. We also want to know, how do we tell our kids, right? So how do we talk to them? And we have a whole entire module in our workbook, and a whole section devoted to that, and really helping parents and holding their hand in a gentle way. And all the way to, kiddos whose parents divorced 8 years ago, and they're really struggling, and there's maybe a lot of anxiety or depression or suicidality showing up. um, I think it's important, I didn't mention earlier, but the later life effects of an adverse childhood experience, kids who grow up and who have 4 or more ACEs. So if you have a kiddo whose parents are divorcing, in addition to, some of those other household dysfunctions. So maybe we have a parent who really struggles with alcoholism. Maybe there's abuse going on in the home. Maybe there's witnessing domestic violence. So you have all these different factors. And when you have 4 or more um, ACEs, it really starts to impact your later life outcomes with your health. So you're 2 times more likely to smoke cigarettes. You're 7 times more likely to abuse alcohol. You're 12 times more likely to have attempted suicide. So that I just, really looking at those later life outcomes, and even twice as likely to have cancer or heart disease. So the impact, right, when we look at that effect on our bodies, our physical bodies, that trauma, right? I love the book, Our Body Keeps the Score, from Peter Levy. It's just really looking at how our body holds all of this. And that's what that study really reflected. So when we look at the impact on kids and we talk about let's call them, those micro adjustments, micro traumas that kids are constantly experiencing, a lot of times kids put in the middle. I see kids put in the middle a lot. And oftentimes parents have no idea that that's how their child is experiencing it. So, I've got a teenager that I work with who needed some money for a big school event, right? So there's a school event, they needed a couple $100s to be able to attend, and went and asked parent A. And parent A said, no, I always pay for everything. Go ask parent B. They never pay for anything. I'm the one that covers everything. I pay the child support. I did. And they kind of rattled off all of the things. Well, if I'm that kid, I just need my needs taken care of. Like I don't need all that information, right? Because that's parent to parent. That's not parent to child. Parent to parent, we want to help parents keep that and really insulate children so they can have a childhood. And kiddos
Yes.
do grow up, they grow up a little faster. They grow up earlier than we would maybe hope for it. They can still be okay, but we've got to help parents to help their kids because they don't know. There's not a manual. That's why Jen and I wrote it, right? We wrote the workbook because we hold so much compassion and care that when you go through a divorce, you don't know. You might have an idea of like, oh, well, no, I never put their other parent down. Yes, foundational, don't put their other parent down because that is a sacred relationship. So that's another really big impactful part for kids is that it's not just the like angry fighting in front of the child. Those are really scary incidences for kids, but it's also just those like snippets of conversations that they hear or when, the backhanded put down or throw the other parent under the bus. And that's
Yes.
hard even if you're a one home family.
Mm.
But it makes, a child identifies themselves as part of each of their parents. And so when a parent puts down the other parent, there's a part of that child in there. Right. And so your parent, parent B is a narcissist. They're selfish. They're this. And they're saying that to their child. That child is identifying with both of their parents. So there's a part I've had kids say to me, Brandyn, do you think I'm a narcissist? Brandyn, do you think, right? Their little brains. Well, honey, tell me, like, why do you ask that? What's coming up there? Well, I heard my parents say that to my other parent, and I don't know what it means. I mean, I've even had kids bring child support checks to my office, and in the memo of the check, I'm not going to swear, but you can imagine what it said. Here's your blankety blank, blank, blank money, you blank. Written on the memo of the check, given to the child as a messenger to give to their other parent because it was transition day.
Just made my throat go tight.
I know. Fortunately, it was therapy day for that child. So when that child was like, what does this word mean? It was a very horrible name calling word. And I read it and was thrown off, right? But it allowed me to help, right? And step in for that family. And you better believe when that child left with their other parent, their next on-duty parent, I called the parent who wrote the check, right? And we talked through that and I had them come in for a parent session with no shame, right? I'm not going to shame you. That's not going to help you. And I see that you're hurting. I see that, and so I hold compassion for all of that anger and rage and resentment that's there. And we got to talk about how this is affecting your kid. And we've got to have some boundaries. So, and not continue to generate that kind of energy within that family system, because to that child, that is their family. And
that's so toxic. And I'm thinking like the mention of shame, I was thinking about the child feeling shame as I'm part of that parent, so I'm ashamed and I'm guilty and I'm blamed and I'm wrong. All of those things that can just take you into an adapted identity of badness. So you'll go up and living in your life as if you are bad, as if your feelings and needs are bad,
right.
as if your existence is wrong.
Yes. And I've had kids say to me, Brandyn, my parents wouldn't be fighting if I didn't exist.
I'm
right?
I'm the cause of everything. Yeah. Not just a nuisance, I'm the cause.
Yeah. I have artwork from children. I do a lot of art with kids, and some of the most impactful parent meetings I have is when, with permission, I ask kids if I can share the artwork with their parent or both parents. And oftentimes one parent thinks the other parent's a monster and they're the good parent. And in the drawing, both the parents are monsters. So it's really helping them to see, oh my gosh, this is the lens my child looks through, and this is their experience of this, and the importance of going, okay, I've got to try to shift this, because I truly believe, outside of some cases, that all parents deeply love their children and want to help them.
Yes, they do. I'm convinced of that too. Yeah. So do you have some successes you can tell us about where there were really difficult times to begin with, but actually the parents came through and the children came through?
Yeah, I mean, lots of those too, which is so fun to talk about. This was many years ago, but I started therapy with a child under the age of 10 who was refusing to go to school, had school avoidance issues and pretty intense clinical anxiety and depression. And parent two home family, and parents really had no idea what was going on and they didn't know what to do. So we addressed the school avoidance, we addressed the anxiety, we were treating the depression. And I just kind of noticed there's something else just really going on within this family system. And I'm trained as a family systems therapist. So that means, for people that don't know what that term means, is if I'm working with a child or I'm working with a parent, I see them within their whole system and all of the threads and layers and relationships and attachments that are going on. I don't just look at that 8-year-old, right? So when I was working with them, and I just said, would everybody be willing to do some family work? And these were parents who could not sit in my office for an initial intake together. They could not sit, across from couch to chair. They could not be in there at all. And just spewing to me hatred of the other, right? When I would meet with them, I noticed, and I would say, hey, I noticed, we've been talking for 20 minutes and you're talking about your co-parent, not your child. And I'm here to help support your child within their family and your child's relationship with you. So gently, right? Just constantly gently. And I would, a lot of intervention and a lot of support and a lot of family work for that child. But it was literally that kid would walk into my office with, just bright eyes like this, right? And big eyes, just physically looked very, very anxious all the time, skittish, right? Just like, what's happening? What's next? Can't regulate. Stress response system activated. Parents are mad all the time. Fast forward, I think it was about a year, a little over a year of support for child and then family work and parent work. You can imagine all the layers and all the support. And I had a co-therapist too who would help with some of the parent work. So we teamed together and really collaborated together to, that child isn't even in therapy anymore, graduated from therapy, went back to school, would at the end would walk into my office in this just calm, regulated space. And the most beautiful part of that work was that child was able to, in session with both parents sitting on my couch, and share what their past experience was and how hard that was for them. And for those parents to be able to listen and validate and not have to defend. Because as parents, oftentimes we defend, right? It's like kids hand us their little precious emotions, and there's these tiny opportunities in life to hold that. And as parents, oftentimes we just step in and defend and we parent, but they were so coachable by the end in a lot of John Gottman's work around emotion coaching, and just sitting in it with their kid, sitting in that this was devastating for their child when they got a divorce, and their own grief and shame around that, right? They were holding that as parents. And when we were able to process that, they both read Conscious Uncoupling. They just did all the work. And I would say that doesn't always happen, where people are like, okay, give me the stuff and I'll do the work and I'll really show up and transform. But they did it. And it almost brings me to tears. Their their kid will be okay.
Oh, that's really beautiful. Can't happen all the time, but at least it's happening some of the time. And that's good for us all right across the world. Thank you so
Yeah.
much for today, Brandyn. Let's
Thank
hold on
you.
and do the next one together too.
Yes, of course. Thank you
Bye for
so much.
now.
Bye for now.